coming in live from Necker Hospital in Paris, France.
Jerome Lejeune has just discovered the cause for Trisomy 21, also known as Down syndrome.
It has been determined that Trisomy 21 is caused by a chromosomal mutation which adds an extra copy to the chromosome 21. Many errors may occur during cell division, such as during meiosis. The pairs of chromosomes split to a different cell. However, occasionally one pair does not divide, which results in the whole pair joining the other chromosomes. This means that one gamete will have 24 chromosomes and the other will have 22. This mutation is called non-destruction. 95% of Down syndrome cases have resulted from non-destruction of a chromosome. Down syndrome is not inherited, but it is linked to maternal pregnancy.
There are two types of trisomy 21. There are mosaic and translocation. Mosaic trisomy 21 causes some chromosomes to have an extra 21 chromosome, while other normal chromosome count of 21. Mosaic trisomy 21 happens in less than 2% of Down syndrome cases. Another type of Down syndrome is translocation. This type results in part of chromosome 21 becomes attached to another chromosome. Translocation mutations are scientific terms for chromosome 21 being unbalanced. This type of chromosome 21 happens in about 3 to 4% of Down syndrome cases.
Down syndrome can be determined in utero. There are two tests that are able to distinguish the fetus while still in the mother's womb. One is called a screening test. A screening test can indicate the likelihood of mothers carrying a Down syndrome baby. How it works is they take a sample of blood from the mother and possibly an ultrasound. This causes no risk to the pregnancy.
The other type of test is a diagnostic test. This can identify whether the baby has Down syndrome. In a diagnostic test, they take a sample of amniotic fluid from the uterus. They will analyze the chromosome and determine if it has an extra chromosome 21. This test does have a possibility of injuring the fetus.
Some symptoms of trisomy 21 include a small head, short neck, flat face, upward slanting eyes, flat ears that are positioned lower than average, tongue protruding and looks too big for the mouth. It also may have an effect on their height. They may also have decreased mental function, possibly have a hearing impairment and speech delay. Down syndrome can also cause some thyroid and heart defects. Many people who have Down syndrome have intellectual disabilities and a shorter life expectancy.
Other names for trisomy 21 are Down syndrome, mongoloid, and Up syndrome. The term Down syndrome comes from Dr. John Langdon Down, who first noticed the different features that people have with Down syndrome. The term mongoloid is an offensive term that comes from Dr. Down thinking Down syndrome was a stage in evolution that began with people from Mongolia in their idiocy. The last name used for trisomy 21 is Up syndrome. People use this term because they recall people with trisomy 21 to always be happy and never be down.
Down syndrome occurs in 1 in 800 newborns. Each year, approximately 5,300 babies are born with Down syndrome. An estimated 250,000 people have Down syndrome in the United States.
Some treatments for trisomy 21 are glasses, physical exercise, physical speech therapy, and special education. There is no cure for Down syndrome, but there are support groups and early intervention programs for the family. Life expectancy is average around 60 plus years. Down syndrome affects their family through everyday activities and learning abilities with their surrounding environment.
This concludes our live investigation on Trisomy 21. We'll be back with more groundbreaking news on World News Today. Just discovered the cause for Trisomy 21. Stop putting me in this.
You're killing me!
I thought it was gonna be you!
Too bad you can't get me doing this.
Lejeune.